Okay, I think we're going to go ahead and get started. We have some folks joining and just want to make sure we have enough time for all the great discussion and questions that will come up in this session. So welcome everyone. We're so glad to have you here today. I see some folks who actually could give some advice as well. So I'm Anisha Patel. I'm a professor of pediatrics at Stanford, and I lead the Office of Community Engaged Research for the Maternal and Child Health Research Institute. And it is my great pleasure to really announce this talk today, which is titled Clinical and Health Services Physician Scientist Trainee to Faculty Career Development. I think you'll learn a lot of pearls in here about great resources through MCHRI and beyond, and also how these wonderful clinician scientists have paved their path to academia. So I would like to first start by introducing each of our speakers today. Our first speaker will be Dr. Preeti Panda. She is an assistant professor in pediatric emergency medicine here at Stanford. She leads the Violence Prevention Policy Lab that is advancing community engaged research to prevent youth violence in the United States. We'll then hear from Dr. Daniel Tawfik. He's an assistant professor in critical care in the division in pediatrics as well. Dr. Tawfik's work focuses on using electronic health record metadata to identify structures and processes that promote high quality healthcare. Last but not least, we will hear from Dr. Yair Bannett, who is an assistant professor in developmental behavioral pediatrics. His work seeks to leverage recent advances in AI technology to improve healthcare delivery for children with developmental and mental health conditions. So as per usual, we have a few slides where we want to just make some quick announcements before we get started with the panelists. So first, I want to give a shout out to the MCHRI Education Committee. I see that we have a few members from the committee here on the call today. So thanks so much for joining and supporting this presentation. Really want to thank the group for all of their work they do every month to really develop the programming for the seminars. Also want to mention this great opportunity to nominate a Stanford Medicine Children's Health employee. So this is not a faculty or a staff, for a Research Champion Award. And you can see the QR code here where you can go and actually nominate someone via a Google form. So please keep that in mind. And these are individuals who are supporting clinical and translational research benefiting our patients. It's not too late to sign up for the Summer Scamper event. It's coming up this actually Saturday, June 21st, 2025. So you can use this QR code to save $5 on your registration. You could walk, you could run, or you could just make a donation. And if you sign up under the MCHRI team, it'll actually go towards great programming such as this, and also some of the grant programs that you'll hear about today as well. Want to also mention the annual MCHRI Symposium. It'll be here before we know it in October 2025. The date is the 22nd. And our theme this year is Healthy Mothers for Healthy Babies. You can actually register now, and you could see the wide range of great speakers that we'll have at that event. Related to that, you can also submit your abstract for this symposium. The deadline for this, good to put it in your calendar, is Wednesday, September 10th, 2025. And again, there's the abstract detail there via the QR code. And I believe this might be one of the last slides. So we also have the opportunity at the MCHRI Symposium to highlight visionary leadership awardees, and these are individuals who have made impactful maternal and child health contributions to the Stanford community. So again, we are accepting nominations until August 4th, 2025, and you can go to the QR code to submit a nomination at the link. All right, so before we start off with the panelists, we wanted to quickly go through some of the programs that they will be speaking about today, so that you'll be able to understand more about some of these programs that they might be referencing that have been critical in their path to academics. and it's securing a faculty position here at Stanford. So these are all MCHRI funding programs. So the first one is the MCHRI Instructor K Award Support Program. So this supports early career investigators at the instructor level who have active NIH K awards, and it's meant to address the gap in research funding because, as many of you know, the K award does not offer very much research funding. And so this provides up to $50,000 per year for up to 2 years. And it's meant, again, to address some of the shortfalls of NIH K awards in terms of enhancing the research budget for K awardees. There's also the master's tuition program that you'll hear about today as well. This supports clinical fellows, instructors, and assistant professors in obtaining a master's degree that's aligned with maternal and child health research. And so this provides basically up to 2 years of master's tuition program support and enables individuals to actually have that funding for the master's degree, which is a huge gift. So you can see here the different master's programs that are eligible here at Stanford. May have a hard time choosing one of these because there are so many now, up to five. And it provides up to $70,000 total, which is $35,000 per year for up to 2 years. And you can see here that the degree must be completed within the 2-year period. There's also the clinical trainee support program. So this is meant to provide up to 100% salary and fringe benefits for up to 2 years. The second year is actually a non-competitive renewal. And this supports clinical fellows who are in their second and third years of fellowship. And the recipients can receive, up to 100% of the salary, but if they actually are a PI on a grant, they can get a $10,000 research bonus. And this is just more about the eligibility. So one of the requirements is that their primary clinical location must be at Lucile Packard Children's Hospital, and that this must be completed. The applicant must have completed at least 1 year of fellowship by the award start date. All right, so with that, I'm going to hand it over to our panelists. First, we're going to start with Dr. Panda now. She's going to speak first. Thanks so much.
Okay, thank you so much, Anisha. I'm really excited to be here to talk to you guys today about my experience with MCHRI. And it really was really instrumental to where I am today. So grateful to give back. Let's make sure these are switching. Okay, awesome. So I'm just going to briefly talk about the work that my lab and my group does, and then chat more about how the MCHRI got me here and led me to be able to do this work that I'm really passionate about. So my lab here, now that I'm an assistant professor, is focused on using data science and community engaged methods to better understand how youth violence is impacted here in the United States, and then create innovative upstream solutions for prevention. And just sort of a bird's eye view of the various projects that we're engaged in right now. One is establishing connections between forms of youth violence. And this is really both on an individual level and also looking at root causes of youth violence and how various forms are truly interconnected, and establishing that in the literature. We're also looking at how the built environment, so the neighborhood that a youth lives in and the components of their infrastructure around them impact their risk of experiencing violence, but also promote resilience from experiencing violence. We are looking at how policies affect both youth violence and experiences of child labor in the United States. And then finally, we're doing some implementation science related work on creating pediatric emergency department-based violence intervention programs to prevent secondary prevention of violence from when we see kids who are experiencing violence in the emergency room. These are the methods that we're focused on, and these are all methods that I'm really truly able to dive into because of the MCHRI support through the master's tuition program. So this includes data science methods of causal inference, geospatial mapping, and implementation science. And then all of the projects that I engage in through my lab are community engaged. So we engage survivors of violence and human trafficking, as well as various community stakeholders to comment on our results of our data science studies and collaborate with us to help the translational impact of what we're doing. So this is a snapshot of my career trajectory, and just sort of going to go through this from the lens of the MCHRI programs and really how these programs supported me to be where I am today. So as a med student, as a resident, I was really bitten by the research bug, and I knew that I wanted to have a career where I could have protected time for research. But even entering fellowship, I really had no idea how to navigate this path to becoming a physician scientist. I didn't know what it entailed to negotiate a career or a position where I would have protected time from research. I wasn't sure, I didn't have a great understanding of what the NIH pathway was. And I knew I needed more research skills that I was hoping to gain during fellowship. And then finally, I really didn't have experience with strong mentorship. And so coming into fellowship here at Stanford for pediatric emergency medicine, we had this amazing opportunity to join the Pediatric Fellows Bootcamp. And through there, that's when I first learned about the MCHRI support and really the whole NIH pathway and how that's a career trajectory that you should pursue if you want to have this protected time for research, if you want to have the privilege of running your own research group. And so at that point, I decided to try my hand at this MCHRI trainee grant, sort of at my first shot at this career, but also just to really see if I enjoyed doing this, if I enjoyed spending months on creating this research proposal and diving into the methods, and if I could really hang with this whole process. My sort of first great experience with the MCHRI program was actually the grant writing club that Bonnie and Gary at the time were running. I hope they're still running it. They were incredible. But it was an amazing grant writing club. They ran it like a regular K Award, R Award grant writing club specific to the MCHRI grant. But it really provided foundational skills for writing an NIH style grant. And I think that was the first thing that this MCHRI grant process really gave you, was skills in creating an NIH style grant. And through this grant writing club, I was also able to participate in a mock grant review. And that was really great as an early trainee getting into this field, to understand the mindset of a grant reviewer, what really happens at these meetings, sort of what it takes to have a successful proposal, and how the extent to which reviewers review your application and how to get certain key items to stand out. And so that was really important. I was fortunately awarded the MCHRI Trainee Support Grant as well as the Master's Tuition Program, and I pursued the Master's of Science in Health Policy here at Stanford, and just finished both of those things last year. I also was able to secure a T32 during my fellowship, and the MCHRI Clinical Support Award really directly led to that. The T32 was a Pediatric Global Health T32, and the creators of this T32 actually looked at the individuals who were awarded the Clinical Support Award through MCHRI to help choose, who was going to be supported by this. And so that really opened the door for me there. And then as a third year fellow, I applied to be a K-12 scholar here through the CTSA at Stanford, and was awarded that. And again, I think, this whole process of securing these prior salary support awards were really important in securing the K-12. Further, I'm continuing to apply for MCHRI grants and, be involved in MCHRI events. I am currently supported also by one of the MCHRI community engagement grants that we're using for our implementation science work. So really just to emphasize and answer the question of how MCHRI helped me transition from fellow to faculty and really be successful in securing a UML faculty position. I think the most important piece is that it opened doors to this career path for me. When I was applying for my UML job, I do think the MCHRI grant and the T32 are sort of my crown jewels, so to speak, of my CV. A major criteria for getting this position was the ability to secure federal funding. And so having this established track of competitive salary support was really important, as well as just the experience of grant writing and writing NIH-style grants. I was also able to build really tangible skills through the Master's of Science in Health Policy. It's not something that I would have pursued if I didn't have the opportunity to get tuition support. And from a peds emergency medicine fellowship standpoint, there are very few fellowships across the country where you even have the opportunity to get a master's degree during fellowship. let alone with full salary support. And again, I don't think I'd be able to be doing the data science work that I'm doing now if I hadn't pursued this master's degree and received this extra training, and just have more credibility to planning studies and executing and creating impactful work. And then just a little bit on what makes this program unique. Just talking to colleagues of mine who are fellows around the country, but even colleagues of mine who were fellows here at Stanford who weren't doing maternal or child health research. There's really no other similar program like the MCHRI trainee support and master's tuition program that's so, in a way, direct and transparent. I feel like going through this program, I really had the steps of what it takes to be a successful physician scientist and what it takes to secure a research track position and to eventually get a K award, sort of laid out to me from the time I was a first year fellow. And it allowed me to really plan my steps, plan my research project that would tie into, a T32 and a K, et cetera, and get that mentorship. And I do feel like when I talk about my experience with other fellows, both here and around the country, that I know, they wish that they had a similar path so that when they applied for faculty jobs, they were better set up for success. The grant writing experience was very foundational, again, through the grant writing club for MCHRI. I still draw upon a lot of the stuff I learned through that club. And then finally, a huge thing for me here was mentorship. And so the MCHRI program really connected me with my first true strong mentorship. And that first strong mentor I had was actually Dr. Anisha Patel, who's helping to moderate this session today. But through this process of applying for the Clinical Support Award as a first year fellow, I was able to find Anisha, and she's been truly instrumental at every step for me in helping me succeed. And I really understood what a strong mentor should be like. Because I did the Master's of Science in Health Policy with the support, I was able to find further methods mentors that have really just strengthened my ability to build my own lab, and still sort of networking with them today. And then finally, I'll just leave with just great opportunities to network with leadership and get some face time with really important people here at Stanford through the MCHRI and through other grants that I've received since then, that I think, has been really important to my professional development. Let me stop sharing. Thank you guys so much.
Thanks so much, Preeti. That was excellent. And thank you for the shout out. Really appreciate it. But I will say that Preeti is a phenomenal human being and just an excellent scholar. So she could have done this definitely on her own as well. So I will then now pass it off to Daniel, who's going to take us through his journey similarly. And I'm very excited to announce I've got to shout out Daniel right now. He just transitioned from his K to his R, which hopefully he'll highlight in his presentation as well.
All right. Well, thank you so much. And thanks everyone for being here. So so I'm going to sort of take a similar approach to what Preeti did, and just kind of share my my timeline and my path a little bit. I have a disclosure slide, which I realize is a little bit of a spoiler alert as well, but I don't have any conflicts of interest other than the grants that I will talk about. So just by way of background and overview for me, so in my lab, kind of the lines of research that we do here kind of fall into 4 different buckets for the most part, all kind of centered around this concept of using existing data to better understand and then ultimately improve the systems of care and improve quality of care for children. And so the various lines of research that we have, one is just about developing better methods to actually quantify how people are interacting with the EHR. So using audit logs and other large existing sources of data, better understand how people actually kind of have those interactions with the EHR. Another one somewhat related to that is then actually using interactions with the EHR to predict provider well-being outcomes, in particular provider burnout. Another line of research is in using those similar data sources to better quantify and identify who the teams are caring for particular patients, how those teams work together, and then various other measures of team stability, team familiarity, and those sorts of things. And then also using kind of these sources of data to pull together and then predict patient safety risks or other contributors to adverse quality of care. And so that's kind of just the general theme of my research, but mostly what I wanted to talk about is this timeline of kind of where things went. So this is meant to be, I guess, sort of an illustration of kind of one way that it can look. And so I've actually been here for a bit longer, so my timeline is a little bit longer. And it sort of looks like this. So I started my fellowship in 2014 here at Stanford. This was in Peds Critical Care Medicine. That's a 3-year fellowship. Overlapping with the end of my fellowship and the beginning of my instructor period, I did a master's degree also in at that time, I think it was called Health Research and Policy. The name has changed since, but through Stanford's program as well. I was an instructor for several years, and then a couple years ago, transitioned to being an assistant professor on the UML line. The grant funding that I had kind of throughout this period, I'm going to highlight. I'm going to talk about all of it, and then I can highlight kind of the ones that are MCHRI specific. Actually, the first research funding I had was through the Jackson Vaughan Critical Care Research Fund. So it's an internal critical care specific research fund that tends to fund fellows research in Peds critical care. We are a self-funded fellowship, and so we don't have the same kind of MCHRI trainee grant that you heard Preeti talk about and that we talked about at the beginning. But I did have kind of a small pilot grant to support some of my fellowship research. During my master's degree, I did receive master's tuition assistance through MCHRI, which was, I think, really kind of in its early phases then, but has then since, I think, developed to a much more established program. But it was hugely instrumental in being able to actually do that master's degree, which kind of similar to Preeti, I found to be very instrumental in having a degree is great, but really kind of what it was helpful for was teaching me things that I didn't even know I needed to learn about doing health services research and making those connections. So a lot of my connections, a lot of my collaborators that I still work with really came from those connections that I made during my master's degree. I also got a Pilot Early Career Award through MCHRI kind of around that same time, funding some of the research that came out of some of my master's programs. A couple years later, got another Jackson Vaughan Fund, this time actually as a mentor of a fellow. And then this was in kind of mid-2020, I got a KO8 through Agency for Healthcare Research and Quality. And then along with that, through combined MCHRI and department support, had that instructor K award support that was mentioned kind of at the beginning as well, which really helped actually fund the research in addition to the KO8, which mostly just provided the salary support with just kind of a small amount of funding for the research itself. During that time, also got a few kind of small one-year grants through the AMA, initially as a co-I while I was an instructor, and then as a PI for the next 2 while I was an assistant professor. Also a grant through the Stanford Medicine Center for Improvement, which is a 1.5-year long pilot grant mechanism. Another Jackson Vaughan Fund as a mentor as well. And then now am just kind of starting the process of starting an R01 that's coming through the NIH that Anisha mentioned as well. So several different funding sources. These 3 that I'm highlighting here now are the ones that were actually sponsored through MCHRI, which, as you can see, just kind of from the timeline, really served as very important launching points. Without 2 of my first 3, and definitely the 2 larger of these first 3 were actually provided through MCHRI and actually really kind of helped provide that foundation to actually provide more research funding and then actually kind of start my my research career. In addition to the actual, research grant funding or other monetary support, were a couple other things that I wanted to highlight that were also supported through a combination of MCHRI and the Department of Pediatrics. And Mary can correct me if I get any of these wrong. Sometimes I don't know exactly which source some of these ended up coming from, but one thing that was actually, I think, highly instrumental was some sponsorship to allow me to attend this clinician scientist investigators meeting. This was actually held out in Bethesda, Maryland, hosted by the NIH through NICHD. And it was a 2-day meeting with kind of young, up-and-coming clinician scientists, which included, opportunities to meet program officers, scientific review officers, Diana Bianchi, the head of the NICHD, and really kind of talk about grant funding mechanisms and kind of how they look at these mechanisms from the NIH's perspective, which I found to be extremely helpful. I also was sponsored to attend the MCHRI hosted Eureka Institute retreat. This was in early 2020. And found that to be actually very helpful as well. A lot of the topics there were around translational research, but also about just how to start a research career and how to build your research lab, and also kind of making a lot of connections with other clinician scientists in the School of Medicine. I also participated in trainee grant reviews, mock grant reviews, pilot grant reviews for the MCHRI, which, in addition to, I think, being helpful for MCHRI, actually were helpful to me, because as a grant reviewer, you really get a good flavor for how you can write grants better on your own. So kind of actually getting that experience from being on the review side of things, I found to be actually quite helpful for learning to write my own grants. And so I actually found this to be a highly valuable opportunity provided through the MCHRI. So these are all the things that I think were helpful to me, but I don't think it would be fair to show all of this without also showing the grants that didn't get funded, because I actually think these were valuable too. It looks, these are all, I don't know how many there are here. But, there are a lot of grant proposals that I put in, that ultimately didn't get funded. And I think one thing is, early on in my career, these are the things that people did not really talk about very much. And so, kind of knowing this ahead of time and knowing kind of how often it was, that a grant proposal would not get funded or other support proposal would not get funded, I feel like, is something that probably should be talked about a little bit more. But in addition, you may, see a pattern here, more and more, grant proposals that went in, and then eventually I was able to get some funding. And then, kind of as my KO8 was starting to get kind of towards the end, kind of more and more grant proposals before I was able to get more funding. And part of, I think, what this shows is that, each proposal that you put in that doesn't get funded just makes your next one that much better. And so it definitely takes perseverance, and it takes, not, getting too emotionally invested in rejection, but just learning from the feedback that you get from grants. And so just wanted to put that out there so it doesn't seem like every grant will get funded. But very grateful for the support that I got from MCHRI. And I don't want to go too long over, but I'm also happy to answer any questions at the end as well. Oh, and the one thing that I should also mention as well, that I didn't really kind of talk about before, is that this really, it takes a huge number of people. And so there are a ton of people that really helped me along the way. My mentorship team is kind of highlighted in bold here, but there are a ton of other people who are highly instrumental in getting the research done and helping get grant proposals in, and just encouraging me along the way. So I just wanted to put that out there as well.
Right. Thank you so much. That was really helpful. And I think with each of these presentations, there are so many pearls embedded that I think all of us could take away to our own research program. So now we're going to end with Yair giving a similar presentation on his path and some of the resources that have helped him along the way. And hopefully we'll have plenty of time to kind of have some question and answer. And it's a small enough group where I think we could have some great discussion. So, okay.
Great, thank you. Thanks everyone for joining. So I'm gonna share also my journey. It's gonna, as you'll see, have many similarities to Preeti and Daniel's journey. I think one thing that I try to highlight here is the fact that I think my journey was a little bit different in the sense that I came to research a little bit late in my career. So I'd like to highlight that, especially for people who are more kind of clinicians and more clinical and starting to show interest late in their career. So that's what I try to highlight. So I wanted to start first with a story of kind of my first, I would say, spark that started me thinking about research. But honestly, when I went into medical school and also started pediatrics residency, I was very clinically motivated. I did not think of research at all. But during residency, I had a patient I cared for. It was a 12-year-old girl in the ICU. Who had carbon monoxide poisoning, and she was in PICU, and I was the resident at the time during my rotation, and I took care of her, and I would take her to hyperbaric treatment in our institution. And I was really concerned about this incident that occurred because of a water heating device in their house that was installed not correctly. Um, and I decided to look into the records at the hyperbaric treatment institute and said, let me see if there are other cases like this. And I literally went through the forms. It was all saved in folders, so real paper folders, and I went through it and searched for similar cases, and I actually found that the kind of 10 years before, in the past 10 years, there were 15 cases of similar uh, children who had similar cases, and I appealed to change the regulation. This was in Israel where I did my training. And I appealed and I successfully had the regulations changed so that these water heaters are no longer allowed to be installed inside bathrooms. So that was really an experience that I felt like it was so rewarding to feel like, oh, this is really nice. Other than providing care to patients one by one, this is an example of, oh, use some data. I didn't think about it like that at the time, but now in retrospect, it's like using data to change care. But I still moved on with my intentions and I became a community-based PCP after completing residency. And that's a younger version of myself there, checking ears. And that's really what I was excited. I loved it and I enjoyed it. But one of the things I learned as I was a PCP in those 3 years was that actually most parents come not so much because, I don't know if most, but many, not so much for ear aches or stomach aches, but actually for things related to the child's development, difficulties with behavior. And I got more and more interested in developmental behavioral pediatrics. And so I decided to come to Stanford in 2016 to complete a clinical fellowship. And if you were to ask me back in 2016 when I arrived here at Stanford, what my career goal was, I would probably say something like, I want to provide high quality community-based healthcare for children with developmental behavioral disorders. And that's why I came to complete this 3-year fellowship. But what I didn't know is that during fellowship, there's, my path will change. And what the first reason for that is because within our division, we have excellent mentorship for research that's really exceptional at the national level. And as Preeti mentioned, I also joined maybe the first, if not the second, grant writing club that Bonnie and Gary started. And those first couple of years in fellowship, I started becoming more and more interested with this incredible support in research. And then my division chief came to me in my second year of fellowship and told me, there's now, it was kind of just starting to be a requirement. And she told me, we're going to start requiring for fellows to apply to MCHRI. And so I was able to secure my third year of fellowship to have 75% of my time for research. And as uh, many of you know, as clinicians, right, that's probably the most important thing is to buy out your time for research. And so that experience was the first time I felt like, wow, this is really incredible. If I have most of my time that I can dedicate to research, I can get things done. And that was a really good first experience for me. And around the same time, I also applied for a grant through the Society for Developmental Behavioral Pediatrics, really with, again, the same idea, the same research idea. And I didn't yet talk to you about my research. I'll briefly discuss it, but again, I kind of wanted to share more about the path that I took. And then now, when you would ask me at the end of my fellowship in 2019 what my career goal was, at that point, I already decided, okay, I'm going to switch course. I actually want to use research as a way to improve care, not just through taking care of patients. And so it would be probably to improve community-based primary healthcare delivery for children with developmental behavioral disorders. So the next step, very similar to Daniel, I went into this period of time as an instructor. And for me, it was right after fellowship that I applied for MCHRI tuition support to complete my master's. And then at the same time, which is again very critical, is that I was fortunate to get the Bridge to K funding as an instructor through the department, which again allowed me to continue to spend 75% of my time in research. And why do we need this bridge to K? Well, for me, it's very clear why I needed this bridge, because my path at the beginning was, and this number shows the number of publications that I had. So when I came into fellowship, and also actually at the conclusion of my fellowship, I still had just 0 publications. I'm not counting maybe like a second author publication when I was a medical student, but that really doesn't count. So in order to cross the bridge, I remember asking my division chief, Heidi, like, okay, so how many publications do I need to be able to submit a K? And she said 3. So it's good when there's a clear answer, at least. So I said, okay, I think I can do that, 3 publications in 3 years. And so that's actually exactly what I did. So my first publication came out right after my fellowship, and then a year later, and then a year later. And so I was prepared to cross the bridge at that point. And these 3 studies, as it says here, were studies that used EHR to assess the management of developmental behavioral disorders in primary care. And that was really has become my focus of my research, because again, as a prior PCP, I was very passionate about trying to use research to improve PCP's ability to offer care to these children. And so I was, with that, crossing that bridge was successful, and I was able to secure a K-23, which is a 5-year career development grant. And the grant aim is to develop guideline-based quality measures for ADHD, and by combining machine learning analysis of EHR data with to assess treatment of children with ADHD. So here again, as mentioned before, it's really important to have direct research expenses, because the K only supports your salary. So that's the place where MCHRI is very generous in offering instructors here at Stanford with this support. And my understanding is that really the only eligibility requirement is to get a K award. And then as long as your research falls within the area of maternal child health, then you can receive this support, which has been really critical. I wanted to point out again a very similar point that Daniel mentioned, that the master's, and I think also Preeti mentioned, that the master's degree really fosters collaboration. It's not just about learning more about research techniques and biostatistics or implementation science, but also in getting to know faculty outside of the department. And in my case, because I'm using machine learning and kind of informatics work, 2 critical people that I met through the master's degree were Nigam Shah and Tina Hernandez-Boussard, who have very large labs in biomedical informatics research that leverage AI to, for informatics work. And so I took courses in the master's, first with Nigam in my first year of my master's, and then with Tina in my second year of my master's, and that kind of fostered that collaboration that I still have with them. Also people in health policy that I have worked with and collaborated with as well. And then within the Department of Pediatrics now, there's, as some of you know, there's also a new division for clinical informatics that I've started collaborating with. And also I wanted to point out the QSU, which really throughout my time at Stanford have been really a critical piece of my ability to really do this research, with support both from biostatisticians, but also now QSU has transitioned to offer also just more broadly data science support for people who use more advanced data science techniques. Another point in my case to mention is that MCHRI also supports Stanford's participation in PedsNet. PedsNet is a clinical research network in which 11 academic centers that you see here on the slide share their EHR data. Currently, I think the number is already over 50 million children who are cared in one of the PedsNet sites, and Stanford joined this network in 2021, and MCHRI supports the Stanford team, and this is something that I've been using in my research. So this is my last slide, really, just to conclude that I'm really excited to have been able to take this journey and take that pivot that I mentioned and secure an assistant professor position recently, just last year, and have this excellent members that I'm working with in a newly formed lab, which we call the Advanced Informatics for Mental Health. And so again, I think to summarize, I would say that MCHRI has been critical, similar to the stories you heard before, in allowing me to make this pivot and change in my career. And I'm very glad to answer any questions people may have. And if you want to learn more about the research that we do, there's a QR code here, or you can feel free to email me as well. Thank you.
Great, wonderful. Thanks so much. So I think now we have some time for questions. And like I said, this is a very small group, so please feel free to just raise your hand, or, and we can moderate, or you could if you want to put your question in the chat, I'm happy to ask it of the speakers as well. And Mary, I don't know if you have any things you want to say really quickly before we open.
No, this just makes me so happy because there was a method to the madness, right? Get your master's. Then if you can get your K, we'll give you extra money while you're trying to get a faculty position. And all three of these extraordinary people just demonstrated so beautifully. The main thing I'm thinking as I'm listening to this is the link to this video. We need to get this into the hands of first-year fellows who really can't even imagine what this would look like, but hopefully will see themselves. And Daniel, your slide with all the grants you didn't get, I took a screenshot. I sent it to Christina Vera, because you may know she does the same thing when she
stole
talks.
that idea from her.
I know. I told her.
Yeah.
I told her, and she loves it. She loves that slide, and as did everyone here. So I commend you for doing that. I think this was just brilliant, and I think this video, we're going to put this to really good use, Anisha, and not just for peds. I mean, it was really important to have Preeti here, that we're supporting all maternal and child health. So I will make sure the link to the video, Becky can help us get it to fellowship directors, anyone in maternal and child health who thinks they might even maybe potentially be interested in a career in research. This should really be required viewing. So thank you to all three of you for all you do and for great presentations. So thanks.
Anyone have any questions?
This is Sushma Reddy from cardiology. MCHRI has this wonderful program which is helping those interested in research actually have a career, and it wasn't so easy before these programs came into play. Do you or the others on the panel have any suggestions for other departments across the university that do not have such programs? How do you support people who are very much interested, but just are unable to buy out their time to do what they'd like to do?
Sushma, who's this directed at, the question?
Perhaps yourself and Anisha?
And Anisha. Yeah, the thing about MCHRI is because so much of our funding comes from the Lucille Packard Foundation, we really have to be true to our mission, and everything that we fund, you have to be identify maternal and child health relevance. That said, we fund people in all the departments, all the clinical departments, and a lot of postdocs we fund in the basic science departments. And we even fund people across the campus with various funding mechanisms, but you have to be maternal and child health. I think if you aren't maternal and child health, I think it's harder because this kind of structure isn't set up anywhere. It has been a little bit hard, Sushma. Like I hear about K grants that went in from other departments, and then their chairs don't realize they could have put in the letter of institutional support that MCHRI will give you an extra $25,000 a year as an instructor on your K if your department will match it. So I continue to try to get the word out to the other departments about what MCHRI does in maternal and child health. But I do think, and I'm not sure does for people, for instance, Sushma, you're somebody who I credit you with the fact that Crystal Botham is now part of our world. I think, but in the cardiovascular, thinking about other institutes on campus, does Cardiovascular Institute do anything like this for people who aren't in maternal and child health? Do they have any programs?
They do have annual pilot grants. They do have a grant writing academy, but nothing compares to what
Yeah.
MCHRI has done.
Yeah.
This actual bridge funding, the supplementation to the K Award. I mean, these are such amazing, amazing programs that no one else has been able to replicate.
Yeah, I think it might be useful for people to know where the money comes from. So it's a good plug for Summer Scamper, everybody. So Saturday is the Summer Scamper. If you donate money to the foundation, if you just decide I want to give a donation to the Children's Hospital and you just go online and you donate generically, it goes to the Children's Fund. We get a third of that. So a lot of what we do comes to us through that mechanism. If you run for the MCHRI team Saturday morning or donate to the team, 100% comes to us. So that's one source of money. The other source of money is I negotiated when I became department chair that the Children's Hospital gives MCHRI $5,000 a year. So I think, $5 million a year, $5 million a year. So I think that revenues, those two sources of revenue stream are what make it different for us. Now we just want to make sure that people are aware of it. And this, I can't think of a better way to make people aware than to have these 3 incredible success stories really demonstrate the power of all the resources. Anisha, do you know of anything else through your role in the CTSA?
I just put in the seed funding website, so you can go there and see all the seed funding sources internal to Stanford. But having come from a public institution with way fewer resources, I think even if you aren't working in maternal and child health, potentially there's just seems like there's many more seed funding opportunities of larger amounts at Stanford as an institution as a whole, that we are very lucky to have the MCHRI resources for tuition support, obviously, and some of the larger grants. Anybody else have any other thoughts?
Hi, this is Grace Kim. I'm one of the pediatric ENTs here at Stanford. I just had a question. It was really great. Thank you to the speakers for talking about their trajectory and their timelines. It's super great to see, kind of just see how sometimes circuitous these paths have been and the number of attempts that don't succeed before you get to where you need to go. But I was curious, coming from a surgical training pathway where it is a little bit different, how our timeline is broken up, and then how we transition from training to faculty, how to optimize resources at Stanford, including MCHRI. For instance, I'm in the process of applying for a K. I won't be able to list that K support from MCHRI as an added resource, but kind of knowing what other things to supplement for persons like myself, where we're no longer instructors.
Anisha, you've mentored a surgeon on
Well,
writing a K.
Katie's on the call. She could. I was
Yeah.
gonna
Oh, is
just
she?
texted Grace.
Oh,
And
I didn't see her.
Katie,
Oh, there you are. Hi, Katie. All right, Katie, you get to take a crack at this one, and then we'll come back to the issue of the instructor support that the faculty don't have access to. Katie, can you want to speak to the timeline issue?
Sure. I think it's really tough, but really rewarding. So I would say that my advice, first of all, happy to chat about it, like really, really happy to chat about it. But it takes a little bit more like buy-in from your leadership. And then also if you've had somebody in your department or division that's done a K, like really following their path, like figuring out exactly what kind of split they did with their time, what they did with their clinics, what they did with their RVU production, like getting that plan from them and seeing like the stepwise function of it is really, really helpful. But always happy to chat.
Yeah, I think there's a couple different issues when we talk about the finances now. So I don't know. Sorry, I'm looking for who was the person that asked the question? Was that Grace?
Yes.
Okay. So there's some nitty gritty issues of Ks that require sort of special consideration. One of them is the salary cost share. I don't know if you're aware of what that is, but the NIH requires for the folks here 75% protected time. I think for surgeons it can be 50, right?
Yes.
Yeah. So it requires 75 or 50% protected time, but it comes nowhere close to paying, even if you get the award, 75 or 50% of your salary. So, you know, even in pediatrics where the salaries are low, even in developmental behavioral pediatrics where the salaries are low, it doesn't do it. So that means if you get a K, your department is going to have to do something called a salary cost share. So right out of the gate, there's that barrier. And I think that for some of the surgical subspecialties or in radiology or other places where the salaries are higher, I think that's one barrier. So that's obviously a really important conversation. The reason, let me tell you a little bit about the history of why MCHRI gives this additional money, but only to instructors. So I knew when I got here that the fact that my letter of institutional support cannot say for Daniel or Yair that I'm going to give them a faculty appointment. I literally cannot write that because they have to win a national search. And I knew that was not going to land well. NIH wants to see that I'm so all in on them that they're going to have a faculty appointment from the word go. But I can't. Like, I literally can't. They have to win a national search. So we finessed this whole language about how they're, you know, going to be an instructor, and that's a position that's reserved for our most promising rising physician scientists, and that we have every confidence that they'll compete for an academic faculty appointment here or a peer institution. I knew that was not going to be enough in some cases. So then I thought, well, what's the problem with being an instructor with a K? The whole point of the K is to get you to the R. And you can't get to the R if you don't have any damn money. So we said, well, if we give all of them $50,000 a year on top of what the NIH gives, then at least you have $100,000, and at least you can hire a full-time lab tech or a full-time clinical research coordinator. So then I thought, what if MCHRI gave every instructor $50,000? And again, that was because I wanted to be able to put in the letter of institutional support and Grace, and this is the kind of stuff we've got to get out to other chairs, but then if we put into the letter where we said, because we're so confident that they're going to come on to the faculty, we're going to give them this extra money to supplement the K until they have the benefit, right, of the faculty appointment and the full startup package. Then I started to think, well, how many are there going to be? So I asked RMG to give me a list of how many instructors in Stanford School of Medicine have K awards who are in maternal and child health, and it was a lot. It was a shockingly large number just going through the titles of the grants, and MCHRI couldn't afford it. It was just no way. So then we said, okay, we'll split it with the department. So that was the genesis. The reason it's for instructors only is partly the motivation for it is to help you get your faculty appointment where you hopefully will get a startup package. This is the idea, is to give you money until you get that proper startup package. And then, so that's the kinds of things where, Grace, are you a CE?
I'm at UML.
UML, did you get a startup package to some degree?
Yes.
Yeah, so that's why you're not eligible for this extra 50, is because you have a startup package. Instructors don't. That's why it's limited to instructors, because our assumption is anybody who's on the UML, and certainly it's true in our department, but it would be, I think it's true in most departments, already have some kind of a startup. But your letter of institutional support still can talk about how MCHRI has a partnership with the quantitative sciences unit. If you're doing community engaged research, you can take advantage of everything Anisha's office does. If you do any research within the walls of the hospital, you should talk in that letter of institutional support about the clinical research support office. The letter of institutional support, I often get draft letters where the first 4 paragraphs are talking about how wonderful the person is, and we're like, yeah, we know that. That's obvious from the grant. This is a letter of institutional support. This is where we've got to get on paper all the things the institution is doing to support you. And that's where MCHRI's Clinical Research Support Office, Quantitative Sciences Units, offices, Community Engaged Research can be the things that go into your letter.
Mm-hmm. Thank you.
Sure.
I don't know if I have time to ask a question.
Yes, you do.
Oh
Okay.
no, I took too long to answer. I'm sorry. Ask your question.
Go ahead.
Yeah, my name is E. I'm one of the neurologists, but my research is in maternal fetal health. I really want to say thank you to MCHRI. This is the first C grant I got before I get any other second or third grant. I just got my K like 2 months ago.
Ooh.
So that was, I think I owe you guys a thank you letter. So thank you so much. I have 3 quick questions. One is I wanted to ask Daniel and other panels experts, like what's your experience, how to grow from K to R? And second is what's experience when you do the faculty position search, like any experience to share, any tips? The third question is a little bit maybe more for Dr. Leonard, for your expertise as a chair. I'm currently a CE line, so it's very challenging. I mean, I have had challenge to.
So why don't you and I have a conversation? Email me and we'll have a conversation. I'm happy
Okay.
to meet with you, but let's take advantage of this brain trust and
Okay.
give Daniel and Yair and Preeti a chance to reply. And I'm happy to talk to you at any time. Just email me.
Okay. Yeah. Basically, just want to learn experience how you become independent. Yeah.
Yeah, I would say, I mean, I can take part of that first one. I would say probably the biggest thing was I used the K to really kind of develop new methodological skills. So like I learned, machine learning and predictive modeling because that was stuff I hadn't done before but wanted to take ahead of time. And then got a couple like small pilot grants to then develop the pilot data for the R01. And so it ended up being like using the K support for the methods, using pilot grants to develop some pilot data to then write the R01. The couple resources that really helped. One, I think Crystal Botham has already been mentioned. She's great, and the whole like grant writing resources group is super helpful. I wasn't eligible for there's an R01 pathway. There's like I think I forgot what it's called exactly, but it's in the fall every year. But
R01
it's
countdown.
R01 countdown. That's what it is. So I applied to that and didn't get into that, but Crystal met with me like on my own on a weekly basis as I was writing the R and gave me feedback through every iteration, which was super helpful. And so I think that was extremely helpful. And then kind of relying on my mentors as well to kind of help with some of that like grantsmanship of like where is a good place to apply. They were actually super instrumental, but I'll let others.
I think one question I have is the K package for research so small, like how can you actually have the funding to hire a biostatistician or coordinator like that?
Yeah, for me at least, really the big benefit was being an instructor on that Bridge to K pathway was it didn't provide a ton of funds. I mean, the extra like Instructor K award funds, helped support a little bit of somebody's time, but a lot of it just gave me time to learn the methods and to just do the work on my own before I could afford to have somebody, kind of working with me. But yeah, without that extra protected time, I don't think I would have been able to do that.
That's true. Yes.
Yeah, I'll just add there, that's something I spent this year thinking about quite a bit is how to sort of use the funds I do have and the resources I do have to get, extra people to help me, research coordinator support and things like that. I do, as a UML, I do have the benefit of having a startup, which is a huge, huge luxury. Especially looking outside at other institutions for faculty jobs, it's here is just the best place to be for that kind of support. So I feel very lucky to have that. But then for me also, I was able to maximize sharing time with my department's existing resources as far as research coordinators. And that's something that I wouldn't have known was available if I didn't ask. Like it's not advertised, but there just happened to be a couple of people who, have salary support through the department already who are between projects that I was able to sort of snag and get for certain project directed work. And so it's great to have someone for you, like who's just for you all the time. But if you're able to have like a project specific person, that's been really great for me. And so I was able to get 2 people from my department to just work on one project and not something that was advertised or anything like that. So definitely ask for those resources.
And MCHRI does have some clinical research coordinator support. You can get small percentages or hourly rates in case you don't have enough funding, right, to afford a full research coordinator. But I think Preeti's suggestion to check around to see if others have research coordinators who have some time that they could give to is a great one as well.
Thank you so much for all the advice. I'm just writing all them down.
Okay, well, I feel like we could be talking on this call for a long time. Does anybody else have any other questions? I do want to be mindful of folks' times, but if you guys, do you guys need to head off to another call? If anybody else has a question. No?
Thank you, Anisha. Thank
Yeah,
you,
no
everybody.
problem. Thanks so much for joining, Mary. Really appreciate it.
Thank you so much.
Everyone. Thank
Yeah,
you.
and if you have any questions after, feel free to reach out to any of us. I'm sure we'd all be happy to share our experiences. I think I mentioned in the chat that I was not at Stanford before. I was at UCSF where they had 0 resources. So I just wrote, like Daniel, like my graph, like my slide would be lots of grants. I applied for so many little grants just to fund ancillary parts that could be related to my K. And that was the way I was able to get my research funds because we had 0 startup, 0 research funds. So we're very scrappy.
Yeah, I mean, that's where I am right now. So I feel a little bit, narrowed down. Like I wish I have 40 hours a day with 10 people in my lab. That'd be great, but that's not reality. Yeah. Thank you again.
No problem.
Mhm.
Bye.
Bye.
Everyone.